there, I'm Tricia Kenny from Thermo Fisher Scientific. Thank you for joining today's webinar, Real-Time PCR for the Molecular Detection and Research of Infectious Disease Pathogens Beyond SARS-CoV-2. We encourage you to participate today by submitting any questions you may have during the presentation. To do so, simply type them into the Ask a Question box and click Send. We'll answer as many questions as we have time for at the end of the presentation. You may also submit any technical issues here as well if you have trouble seeing or hearing the presentation. We have two great speakers today from Thermo Fisher Scientific. Celeste Stone is Senior Manager of Business Development. She has been supporting the infectious disease and pharmacogenomics molecular testing research portfolios for the past decade. Celeste has a Bachelor's of Science in Biology and Anthropology and a Master's in Teaching Biology from the University of Pittsburgh. We also have Jorge Fonseca. He holds a degree in Mechanical Engineering from MIT and an MBA from the University of Massachusetts Amherst. Jorge started his career in R&D, where he was involved in the development of real-time PCR products. He has since moved into product management, and he's covered research, agrigenomics, and clinical research applications. Currently, he leads a team responsible for molecular testing research solutions spanning infectious diseases, oncology, and pharmacogenomics. We have a great agenda today. The 35-minute presentation will be divided into 4 sections. First, Celeste will cover infectious disease detection and research methods and the benefits associated with molecular testing. She will turn it over to Jorge to discuss the critical quality and performance parameters implemented for assay design and manufacturing, followed by an overview of molecular testing workflows, including the ability to scale based on instrument and format options. And then Celeste will finish the webinar by exploring how to expand your infectious disease research and testing menu. So I'd like to hand over the webinar to Celeste.
Thank you, Tricia, for the introduction, and thank you all for joining us today. If you are a current customer familiar with our products and support, we greatly appreciate your partnership over the years. We hope we can continue to support your success. Many of you have come to trust and rely on us due to our intense commitment during the pandemic to create a test that was robust not only in performance, but also in supply. For those of you we haven't had the opportunity to work with yet, a quick bit of background on that very impactful year for the laboratory. During the height of the pandemic, over 50% of the testing utilized our technology, either our instruments or reagents. We have helped our amazing customers collectively perform over 700 million tests to date. And what was most impactful during that time, and also very stressful, was our ability to scale our production to secure supply chain and meet global testing demand. It was no easy feat, and I'm very proud of my colleagues around the globe who contributed to that level of passion and hard work. Prior to the pandemic, we built a portfolio that could service our customers from end to end: instruments, reagents, software, service, and support. We were able to leverage that foundation throughout the pandemic, and now we want to continue post-pandemic to be a complete and trusted resource for our customers. So if we hadn't had the chance to be of service to your laboratory yet, we'd love to hear from you. So what's next for your lab? We've made it through the pandemic years of high demand COVID testing. Of course, COVID testing will continue to be crucial, but will you maintain your current testing strategy, or will you explore things like pooling as infection rates decrease? Or will you look at other sample types such as saliva? Or will more rapid PCR detections be a need? Moreover, as we shift into fall and flu season, will you need to explore a broader respiratory menu? Keep in mind, we have our COVID flu EUA as well as panel-based respiratory options, which I'll get more into later. When you think what's next and begin that exploratory process, whether it's infectious disease, inherited disease, oncology, pharmacogenomics, we'd love to join you on that journey. And within that journey, I do want to recognize the challenges you face each day, from how to maintain profits and revenue streams within an ever-changing landscape, to staffing challenges and shortages, technology advances to keep up with, competition with other labs. Clearly, support to address these challenges is needed, and your ability to continue to operate and be of service is crucial. And to that point, let's take a look at the impact infectious diseases have globally. 6.8 million doctor visits per year, 15% of all healthcare expenditures, and they kill 250,000 to 500,000 people each year, with costs between 71 billion to 167 billion annually. There is a clear need for fast, low-cost detection solutions to improve care and reduce healthcare expenditures. Now, taking a look more granularly by top infectious diseases that impact our world, respiratory tract infections, leading cause of burden worldwide, with viruses such as the common cold and flu leading the way. But it is the bacterial infections that tend to cause more severity, namely pneumonia and tuberculosis. And of course, testing speed and sensitivity is crucial, and that's why implementing qPCR-based tests is so favorable. Looking at other tests that could also benefit from this approach, urinary tract infections. They are among the most prevalent diseases globally, resulting in approximately 150 million deaths a year. Challenges such as high recurrence and antimicrobial resistance threaten to increase that burden. And when you consider the limitations with current testing methodologies, culture, for example, can take days, and fastidious organisms or polymicrobial infections resistant to culture pose a challenge. A multiplex qPCR approach can significantly decrease turnaround time while being highly sensitive and specific. While UTIs threaten the elderly population more than other demographics, GI infections are the second most common of infections worldwide and can be deadly among infants and children. And unlike UTIs, not only are bacteria significantly impactful, but also viruses and parasites. Again, a qPCR method can address testing all of these types of organisms simultaneously versus employing multiple testing methodologies such as culture, microscopy, and immunoassays. Moving on to another area of infectious disease testing that is very crucial for the female population, vaginal infections. When a healthy vaginal microbiota is disrupted, an overgrowth of pathogenic organisms in the flora can cause infections such as bacterial vaginosis, candidiasis, trichomoniasis, and higher risk for sexually transmitted infections. Bacterial vaginosis is quite prevalent, up to 29% prevalence globally, which translates into a global economic burden of 4.8 billion. When we add the impact and burden of STIs, considering this number keeps climbing year over year, and it can result in life-threatening complications, we know early detection is crucial for both vaginal infections and STIs. Again, traditional methods, culture, antigen-based tests, serology, they all fall short of the speed, sensitivity, and specificity molecular methods offer all in one standalone test. To sum up, infectious disease testing is inarguably very crucial globally, but there are challenges with each of the traditional methodologies. When we consider culture, it is specific only to the bacterial targets and can have limitations when dealing with fastidious organisms or instances of a polymicrobial infection. Moreover, results take days. With microscopy methods, we are considering subjectivity concerns and lack of trained microscopists. There are also challenges with other molecular tests that have fixed content, that lack flexibility or the ability to add new pathogens of concern quickly. For these reasons, we are indeed seeing a rise in demand for molecular testing methodologies, as they can afford within one test speed, specificity, and sensitivity without the challenges of multiple traditional methodologies. Key qualities of a successful molecular diagnostic test include analytical and clinical validity. qPCR is considered a gold standard and has become the most popular molecular diagnostic choice for many clinical applications. Two other key qualities and of immense importance are clinical and economic utility. We talked about the need for faster, more encompassing testing in a single method to help ease the demand and economic burden, and a molecular diagnostic approach can help address this need. And with that, I'll pass it on to Jorge to further discuss critical quality and performance parameters.
Thank you, Celeste. Indeed. So having heard from Celeste, the importance of these applications and the need for development of assays, let's talk about the parameters and processes that are used and implemented by Thermo Fisher towards that purpose. So how do we go around developing and putting together this PCR-based research solutions for infectious diseases? So it starts with the content, the assay selection. Our team identifies and gathers pathogen assays for the most common infectious diseases, especially those that would benefit from molecular testing. In doing so, we leverage information from literature, information from key opinion leaders, and feedback and input from our customers who are subject matter experts in these. We take that information and we use it together with our R&D and bioinformatics teams to develop expanded content panels in a variety of formats that you'll see in the following slides. And we do that with a focus of having the highest number of pathogen targets available in the finished product. We take those assays that we have designed and then we integrate them and optimize them as part of an end-to-end workflow solution. So that includes optimizing and integrating the sample preparation, the extraction, and the reporting options to complete this workflow solution. And the end result is we are then able to launch flexible content, real-time PCR solutions for a variety of panels spanning syndromic, fixed content, and focused disease panels for infectious disease research areas, of which we'll talk later on in this presentation. So, having talked about how the journey of the design process starts with the assay, we of course want to know about the technology and chemistry that enables the performance of those assays. For us, that is the well-known and industry-accepted Tachman chemistry, which is validated by hundreds of patents and publications. The key step in the development of our assays is our well-developed and validated bioinformatics pipeline for the development of primer and probe sequences. That tool has been optimized through years and production of millions of assays in our catalog and manufacturing of tens of millions of assays that we ship to our customers years after year. The pipeline integrates the manufacturing data of those assays and uses that to optimize the design of future assays. As a result, our Tachman assays shine in the 4 areas of specificity, sensitivity, reproducibility, and performance. On the area of specificity, our advanced primer and probe sequence selection criteria through the bioinformatics pipeline, together with the MGB probe chemistry, improve the performance in the areas of specificity and reproducibility, knowing that the amplification is coming from the intended target and not from non-specific dye binding. On the area of sensitivity, the non-fluorescent quencher on the Tachman probes minimizes the background signal, and together with the primer and probe design, maximizes the amplification efficiency, which gives you better sensitivity and accuracy, which is important and enables you to detect targets at 10 or fewer copies in your samples. And in the reproducibility, we are able, through our manufacturing process and quality control process, to deliver reproducible results across various wells in your plate, across various tests in your run, and across various lots of the product. And of course, we stand behind the performance of these assays. If they do not perform as promised, we will replace or refund them. So having talked about the Tachman assay chemistry, let's talk about the specific kind of PCR run, which is most used in these applications with its gene expression. So as you know, reproducibility and the robustness of the amplification are essential when evaluating the performance of gene expression. And as you can see here, we deliver on both fronts. You can see the graph on the left demonstrates the lot-to-lot consistency of our Tachman gene expression assays, as evidenced by the low delta CT variation. And on the right, you can see the efficient amplification, which is centered around 100%. So now let's talk about the workflows. Let's talk about how you can use these technologies to develop end-to-end workflows for the various applications that Celeste discussed, and how you can choose the right products to meet your needs depending on your throughput. So let's first look at this family of instruments on our QuantStudio qPCR portfolio. And you can see it spans a variety of instruments. We'll go into a little bit more detail in the next slide. I'll just highlight here that they go from lower throughput instruments with fixed block systems that are better suited for plates, all the way through medium throughput systems with interchangeable blocks that can accept a variety of consumable formats, and all the way through high throughput for specific formats, which we'll talk about in the next slides. And as you can see from the graphic, the vast majority of these instruments are cloud enabled, and several of them are automation ready. So let's discuss some of the details of the instruments available in our portfolio. So starting at the lower throughput end with the QuantStudio 5 system, this is a fixed block system that is compatible with Tachman array plates, be it 96 or 384 well blocks. And as you can see, it's better suited for low to medium throughput testing labs. Going up in throughput, we have our QuantStudio 7 Flex and QuantStudio 7 Pro systems, which are compatible with Tachman array plates, both 96 and 34 well as our microfluidic Tachman array cards, which offer 384 reactions, and which we'll talk about in a later slide. And then moving up in throughput, we have our most flexible and higher throughput system, the QuantStudio 12K, which is compatible with all the previously mentioned consumables, as well as the open array plate, our highest throughput consumable, which we'll see in the next slides. Having spoken about the instruments, let's look at the matching consumables that complete those workflows. So once again, a range from lower throughput to higher throughput. We start with the familiar Tachman array plates on the 96 well format, which offer reaction volumes of 10 to 20 microliters per well and are better suited for lower to medium throughput applications. Going up in throughput, we have our 384 well assay formats at 10 microliters per reaction volume. And then moving on to the microfluidic formats, we have the Tachman array cards. Those bring the reaction volume down to 1 microliter and offer 384 reactions. And on the highest end, we have the Tachman open array plates, which have only 33 nanoliter reaction volumes. And we'll talk about the specifics of each of these formats in future slides. But it's important to know that the Tachman assays that we discussed in previous slides can be made available pre-spotted in various configurations and in each of these formats, depending on your needs. So let's talk about the first format, the Tachman array plates. These are the familiar 96 and 384 well formats. The good news here is that you can select whatever content you want from our Tachman assay menu, and we can have those pre-spotted and conveniently dried down in the plate formats prior to delivery, eliminating the need to pipette the content upon receipt at your lab. These are optimal for low to medium throughput lab solutions. They require a low sample input of only 5 microliters per reaction and are compatible with the QuantStudio instruments that we saw in the previous slide. So what is the workflow that you would use with the Tachman array plates? It's a very familiar workflow. So as you see, you would start by receiving your samples. The workflows would be compatible with a variety of sample types, including urine, swabs, or nasopharyngeal samples. The sample preparation can utilize our Thermo Fisher Kingfisher Flex purification system, as well as our Applied Biosystems MagMag kits, which enable up to 96 samples per run with a semi-automated workflow. And then the real-time PCR happens in the QuantStudio family instruments that we reviewed in the previous slides. To complete the workflow, we have various options for analysis and report, as well as compatibility with third-party tools that you may use for interpretation of your data. So going up in throughput and talking about the Tachman array cards, for those of you that are not familiar with this consumable format, they have the same footprint as a 96 or 384 well plate. They are plastic consumables with a foil backing, but they are a microfluidic reaction volume consumable with 384 reaction sites, as you can see. So the way this works, and we'll look at the workflow in the next slide, is the user is able to pipette 8 samples into the 8 wells or lanes that you see on the screen. There's a process in which the sample is distributed to the reaction sites without any risk of contamination and without the need for complex robotics or automation. That minimizes the hands-on time to only 10 minutes to add the sample and master mix. And because of the low volumes utilized, it's a very cost-effective approach that minimizes your reagent usage. As seen in the previous slides, this particular format is compatible with the QuantStudio 7 family, as well as the QuantStudio 12K family of instruments with the dedicated blocks. In terms of the workflow, as you can imagine, it's similar to the one we reviewed for the Tachman array plates. The only difference here is in the sample loading. So I talked about the first part of the process, easily loading the sample with a pipette into each one of the 8 lanes without risk of contamination and with very low hands-on time. After that, there is a sealing step with an including tool. It's a very quick manual process, and the loaded cards are spun in a centrifuge to distribute the samples. That entire process requires less than 10 minutes hands-on time. The entire workflow has a turnaround time of 3 hours to first results and 5 hours total per run. And of course, our technical support teams are available throughout the process to help with any questions that you may have. So now let's discuss the open array plate consumable format, which is our highest throughput format. For those of you who are not familiar with an open array, it's the size of a microscope slide, made of metal, very thin, and populated with over 3,000 through holes. So they do not have a bottom like traditional wells. In our proprietary manufacturing process, we apply a hydrophilic coating to the inside of the through holes and a hydrophobic coating to the external surfaces. That has the end result of allowing us to perform individual qPCR reactions in each of the 3,072 through holes without risk of contamination with neighboring reactions. And as you can see in the slide, you have great flexibility in how you can use those reaction sites, from maximizing your panel size across fewer samples to selecting a smaller panel content and maximizing the sample throughput in your testing. And the platform is available for supporting both genotyping and gene expression applications. In terms of the throughput, each QuantStudio run can run 4 open array plates at a time for over 12,000 reactions at a time. And in terms of the time it takes to generate the results, you can either run 12 to 16 open array plates per day, depending on your shift structure, which translates to 35,000 to 45,000 total reactions in a day. It's a very fast benchtop workflow with minimal hands-on time. All that is required from the user in the lab is to load the samples and master mix in the workflow that we'll see in the next slide. And that can be done in as little as 20 minutes. And due to the 33 nanoliter reaction volume, there's a high efficiency of reagent usage and cost savings that comes available with that. So let's talk about the workflow for the open array plates. As you can see, there's a trend here. The workflows are familiar and there's minimal change from one platform to the other. In this case, the change from the previous formats is on how the samples are loaded on the open array plate. There is a system dedicated for this step. It's called the Open Array AccuFill system. Very convenient workflow. All you have to do is place your 384 well plate with your desired samples, select the configuration, hit go, and the robot will automatically deposit those samples onto the open array plate and provide the information onto the placement of those samples for use in the workflow steps of your analysis. And then that moves on to the QuantStudio 12K, which, as we mentioned, can run 4 arrays at a time with a 2 to 4 hour cycle time, depending on the application. So wrapping up, let's look at how these consumable formats that we've discussed compare with respect to throughput and what advantage they offer. So we start with the lowest throughput single tubes that we are all familiar with. Those are available as inventory products and give you the highest flexibility for the lowest throughput. In terms of the consumable formats that we've discussed today, we have, of course, the Tachman array plates available in both 96 and 384 well formats, offering the convenience of pre-spotted assay content. And they run on the instruments that support automation and are ideal for medium throughput. Moving on to the Tachman array cards, those support 384 microfluidic reactions, as we mentioned, also offering the convenience of pre-spotted assays while minimizing the risk of contamination and simplifying your hands-on workflow. They offer great convenience and cost savings without the need for complex robotics. And on the highest end of the throughput scale, there are, of course, the open array plates, as we mentioned, which offer over 12,000 reactions per instrument run. That is the highest throughput for qPCR solutions, which is ideal for high throughput research applications or large projects. In terms of the flavors of products that are available for each of these, all of the plate formats, Tachman array plates, cards, and open array plates are offered in both inventoried and custom content. And now I will pass it back on to Celeste.
Thank you, Jorge, for that review of our instruments and formats. Continuing into the last section of our discussion today, I'd like to highlight our offering for infectious disease. We have several inventoried panel options available, from respiratory with our broad panel of viral, bacterial, and fungal targets compatible with multiple sample input types in broad strain coverage, to UTI, which enables increased accuracy of urinary tract pathogens, quick turnaround time, and overall better sensitivity compared to culture. For vaginal testing, we offer a comprehensive panel that incorporates bacterial vaginosis, candidiasis, aerobic vaginitis, and STIs. And as Jorge touched upon, these assays have all demonstrated to be highly accurate with reproducible performance and are compatible with different sample input types as well. I also want to mention we will soon have officially launched a comprehensive GI panel, and we offer customs for wound, nail, and resistance gene testing. If the inventoried solution doesn't meet your needs, all of our content is available in flexible formats, as Jorge reviewed, or customizable by content. Plus, we offer support, which I'll touch upon more in a following slide. I thought it made sense, given the global impact that antibiotic resistance is having and the need for antimicrobial stewardship, to highlight our offering for antibiotic resistance gene assays. We know resistance genes can be shared between bacteria through horizontal gene transfer, and resistance genes within pathogenic organisms is a growing threat to public health, rendering once effective antibiotic treatments ineffective. We offer the option to complement any panel with our antibiotic resistance genes, or they can be ordered as single tubes. Highlighted at the bottom are common ABR genes of interest that we offer. And keep in mind, you can also create your own custom assay if we don't have your gene of interest. So as you can see, we have all the content and flexibility, but what about support? I want to highlight our analytical validation services, which is so valuable when there is a learning curve or when time is critical. Purchasing an AV affords you a project manager and an on-site dedicated FAS to help verify assay performance parameters. We will help you develop and optimize your validation workflow, supply controls, as well as analysis support and template documentation. Our goal is to streamline the validation process and save you time. We know your time is valuable. So wrapping up here, everyone. And again, thank you so much for joining us. We hope this has been informative for you. If there is one takeaway from this discussion today, it's that we pride ourselves on what we bring to the table for molecular detection of infectious disease pathogens. And we strive to be a trusted partner supporting your journey in the lab. We believe our instruments and formats provide flexibility into the future as lab needs change, and that our expansive network and industry knowledge make us a partner you can trust to meet your evolving needs. And with that, thanks again for joining us. Please do not hesitate to reach out and let us know how we can best support you. We love hearing from you.
Thank you, Celeste. Thank you, Jorge, for your presentations today. We did have a number of questions come in, so I'm going to try to ask you these questions in some sort of meaningful order, so we're not jumping back and forth too much. The first one I see is about false positives. So the question is, I'm concerned about false positives with a molecular approach versus culture. Can you speak about the challenge in dealing with false positives and possible cross-reactivity within a sample? I don't know. Celeste, do you want to take that one?
Sure. And it's a great question. And this is exactly why we offer validation services. It is necessary to establish a limit of detection to demonstrate reproducibility and establish cutoff criteria for accurately making those positive calls. Regarding cross-reactivity, as part of the validation process, you will also perform exclusivity testing in order to understand the assay limitations and how to properly interpret your data. I hope that addresses the question there, but please feel free to reach out if you want to further discuss.
Here's another one. When you are dealing with commensal organisms on a panel, how can I be sure that I'm making the proper decision to characterize a sample? It's either pathogenic or infectious.
I'm happy to take that one again, Trisha. It's kind of in a bit of a similar vein. And again, it's a really good question. And I will point back again to validation. It will allow you to look at both negative and positive sample types in order just to establish that proper call criteria.
Okay. I'm going to ask, I think this one would be for Jorge, and I think you mentioned this during your talk a little bit, but can you tell us a little bit more about how Thermo Fisher determines what pathogens or, to put on their panels, even designing the specific targets to the different pathogens? Can you tell us a little bit more about that?
Yes, of course. I think it's another great question. And you're right. I alluded to it a little bit in the presentation. So it starts at the early stages with our bioinformatics and R&D teams reviewing the literature in terms of what's most relevant to the applications. We also work with key opinion leaders who are subject matter experts in this area, take their input. And of course, as we advance a little further in the project, we work with early access customers who have experience in these areas and are developing these panels. So it's an iterative process, but we feel confident that at the end, we do end up with a highly relevant selection of pathogen targets and the corresponding assays.
I believe on the Thermo Fisher website, there's a tool that folks can use to look up pathogens, targets, etc., to see what might work best for them, depending on whether they want to buy a panel or, design something on their own.
That is correct, Trisha. That's a great call out. Yeah, so if you go to our website, there's a dedicated search experience specifically for microbial detection assays. So you can look for assays that are available at the target level or even at the strain level. And for the results that you receive, you will not just get one result. So you'll see everything that's relevant. If you make a broad search, you'll get a broad list of results. And there are multiple features and functionalities that allow you to dive into the details of each assay and determine the one that's best for your specific need.
Okay. Okay. So that's great for customers who are thinking maybe about designing their own panel.
Indeed.
Versus more of the off-the-shelf products that are available. Okay, that's great. Can you talk a little bit about the platform itself? The question says, do these platforms require sample batching?
Yes. Basic point I should have mentioned. Yes. So as you saw from the presentation, we have a variety of instruments that are suitable for different throughput levels and a variety of consumables that also match that spectrum of throughput. So what we found is the experience of our customers is that we are uniquely positioned to help them maximize the efficiency of their operations through the batching element of our platforms, while being able to tailor their solution to the throughput that they have. So no, they do require batching, but because we offer that flexibility of workflows, the lab can tailor their selection to the throughput so that they're able to maximize the efficiency without sacrificing the throughput need.
Okay. I think this one might be a good one for Celeste. Your products are research use only, but as a clinical lab with minimal LDT experience, what support or guidance can you provide for me?
That is correct. Our products are research use only, but as mentioned, we can provide analytical validation support. And while the clinical validation would be the laboratory's responsibility, there are certainly third-party resources that could assist you through the clinical validation.
Okay, we have time for one more question. Question is, I'm a region impacted by the new MolDX LCD. What guidance do you have for a lab going through the technical assessment approval process? Maybe Celeste, would you like to take that one?
Sure. Yeah, happy to. I do understand that your CLIA validated test has to go through additional validations according to the new MolDX guidelines. I recommend going directly to MolDX for your questions. They have a dedicated email for this purpose. If you are not getting your questions fully answered via email, perhaps you can schedule a meeting with them to further understand their expectations. If there are particular challenges you are facing in order to complete your technical assessment and including the additional validation work, there are third-party resources who may be able to further assist you through that process.
Okay, great. Thank you. So I just want to say thank you again to our speakers, Celeste and Jorge, for your time today and your important research and supporting this portfolio. We would also like to thank Labroots for hosting us today. Thermo Fisher has been the sponsor for today's webcast. Before we go, I want to thank the audience as well for joining and all the interesting questions. Questions we didn't have time to address today, and those submitted during the on-demand period will be addressed by the speakers via the contact information you provided at the time for registration. And this webcast will be viewed and available on demand. Labroots will alert you via email when it's available for replay. We encourage you to share that email with your colleagues who may have missed today's live event. And anyone interested in learning more about these products, again, Thermo Fisher scientific representatives would be happy to speak with you. So thanks again, and hope to see you all soon. Goodbye.